nurse practitioner outreaching to someone on the streets. And then this, again, is the team working together, and the team here includes the psychiatric nurse practitioner, the medical assistant, and case manager. So these are just examples showing how it's, the team working together on the streets, and that is really how we designed this team. With IMHT and all of our innovation programs, UC San Diego did an extensive analysis. We did a lot of data collection for this program, and they did an analysis for us. And when the program, it was a 3-year pilot, which ended in June 2015, and then converted to a full-service partnership program. So in 2015 in June, when the program ended and we got our final analysis from UC San Diego, 75% of the clients showed significant improvements in overall health, and we had many different health measures that we used for this. 73% of the clients made significant progress in their recovery. 33% of clients had a significant reduction in alcohol consumption, and 28% of clients had a significant reduction in drug use. Also, there was a significant decrease in emergency services. Reductions in inpatient and emergency department resulted in $303,000 of costs avoided. And as Gabrielle said, there's been lots of studies across the country to show that if we can help people who are homeless move into housing, it actually costs the public system less money. Because they're not as likely to use emergency services and all of the fire department, police department, and getting arrested and all those things. And then also 60% were enrolled in permanent housing. And actually the Exodus LA Christian team, their services are located in a housing development because it was a requirement that they partner with housing resources. And so they are at the New Genesis, which is a housing development that Skid Row Housing Trust has, and they have offices on the ground floor, and that's where their team is located and provides their services. So after we did the IMHT, we then developed the multidisciplinary integrated teams. And I know I saw some of those teams here. I saw Bonnie. Are there other MIT teams here? Nope, okay. So we have, this is very similar to IMHT, the same target population, the same program goals. Unfortunately, less funding, and also the physical health care was not provided by an FQHC in this model. Actually, DHS hired nurses that are on each of the teams. There's 8 teams countywide, 1 in each service area, serving 60 clients. And one thing that we did to ensure the housing component with this is that we applied for 2 grants through LOS's RFP, or NOFA. And got Shelter Plus Care from the City of Los Angeles and the County of Los Angeles for a total of 186 Shelter Plus Cares, so we could use them with the clients served in this program. And also we had 80 flexible housing subsidy vouchers for the clients. Oops. I did something wrong. Okay, sorry. Okay, so the staffing, you can see very similar, but we have licensed people, substance abuse counselor, case manager, the peer again, and then the half-time DHS registered nurse that's part of the team. So we only had enough money for a half-time nurse, and so the nurses split their time between the 2 teams that they're assigned to. One other unique aspect of this program is that we require the evidence-based practice critical time intervention. And you might be aware of that practice. It's an evidence-based practice that helps people integrate who are homeless into the community. And it's a short-term model of 9 months after the person moves into housing that's really focused on helping people get integrated in the community, that they get connected to services in the community, and that they really understand what it means to be a tenant. Like, what did your lease say? What do you need to do to retain your housing? So this program started about a year ago. They've served 838 people as of June, 276 people engaged, and 73 people housed. And I'll just say that even with Shelter Plus Care available and other housing resources, and Peter already talked about this, it is really hard finding housing in LA right now. So I know many of you do this work every day, and even though we have the subsidy, which often that was the problem, now the problem is you have a subsidy and you can't find a landlord to take it, and that's one of the challenges. So I'm just going to close really fast that, DMH, we know that when we have these programs, we have to have the housing side. So we have a temporary shelter program. We have 13 contracts with the city and the county housing authority for Shelter Plus Care, Section 8, the Homeless Veterans Initiative, those types of tenant-based resources. We have our MHSA housing program where we've invested $126 million in building housing for people that we serve. We have 46 projects countywide with 990 units. That program is now called the Special Needs Housing Program, and we're actually about to release $13.5 million for people to respond to if they'd like to build more housing for our clients. So be aware of that. If you know someone, it's our expression of interest. It should be released, I hope, in a week or so. And in case if you don't know how these subsidies work, basically the tenant pays 30% of their income, and that's what makes it affordable. So whatever their income is, if it's GR or SSI or whatever, they're only going to pay 30%. And then we also have a housing assistance program where we help pay for the security deposits and household goods for people, because even if they find an apartment, they get a subsidy, they find an apartment, if they can't pay the security deposit and then they can't furnish it, we haven't completed our job. So we do have resources for all of that. This just quickly tells you the housing inventory. We have about 3,500 units that we manage of permanent supportive housing for our clients and 193 shelter beds on any given night. So just to give you an example, last year, 2015-16, through our MHSA housing program, we helped about 165 people move into housing, and by the end of that year, 828 people were in our MHSA housing programs, which are project-based. And through our tenant-based program, 322 people got housed, with a total of 1,100 by the end of the year. And then just what's coming next, many of you have heard of No Place Like Home, $2 billion bond signed in September, and using MHSA funds to secure the bond. And so we think LA County will get about $750 million from that. So if we already built 46, or we have 46 projects with 100